Hello Shady lovers, welcome to the continuation of the blood pressure management in kidney failure. So I'm done with the ACE inhibitors, which is the Lisinopril and Ramiprils, those ones where it basically blocks the conversion of angiotensin 1 to angiotensin 2 to limit fluid retention and constriction of the blood vessels. When this class is not really tolerated in patient, the alternative that's considered is got to do with the Arbs, which is the angiotensin receptor blocker. So this is it. So after the angiotensin 1 is converted to the angiotensin 2, at the end of the day, this angiotensin 2 has to bind to its receptor, and when it binds to its receptor, what happens in there is what results in the constriction of the blood vessels and fluid retention in the system. So in this case, when we use the Lisinopril Ramiprils, which is the ACE inhibitors, and we use the Arbs, that's the Losartan and Losartan, what we are achieving is that at the end of the day, we are trying to achieve one goal: to prevent either the production of the angiotensin 2 or prevent the blockage of the angiotensin 2 binding to its receptor. And in effect, it helps reduce the blood pressure because the blood vessels wouldn't be constricted and there wouldn't be fluid retention or fluid accumulation in the system. This is what happens, and this is how it helps bring the blood pressure down. But in this case, with this in kidney patient, one thing we need to know is that the system is already having electrolyte imbalance, and therefore there could be high levels of potassium, which is a major disruption in kidney failure patient. But with these ACE inhibitors and Arbs, what they do is they cause the release of potassium, or they cause an increase in the levels of potassium. Let me the shady way for you to understand it. What is happening here is when the angiotensin 2 is being blocked by this medication, it also directly blocks what we call aldosterone. The aldosterone is a hormone which, in its role with regards to the kidney, is that it helps with the reabsorption of sodium and also helps with the excretion of or the removal of potassium. So when the angiotensin 2 is inhibited, it directly affects the aldosterone, causing potassium accumulation, and that's what's going to result in hyperkalemia, and that's life-threatening. I'm going to continue this in the next video. Thank you, Shady lovers.